When we are first starting out with our cervical evaluations, we always want to make sure that we are observing the patient as they walk into the athletic training or physical therapy clinic. So for Cole, I would look at him from the anterior view and then also from the lateral view, making sure that he has normal curvature of the neck, which would be lordotic. And then you could also assess other parts of the spine, but we will move into that later in the semester. After we've observed the patient, then we're going to go ahead and move into palpations. So remember, off of the lecture video, there are bony palpations and soft tissue palpations. Remember that before we ever put any hands on a patient, we always ask for consent. So Cole, is it okay if I palpate you?
Yes.
Okay. So the first thing we're going to palpate are our bony structures. So remember from the lecture, the first three are the hyoid, the thyroid, and the cricoid cartilage. So for the hyoid bone, I'm going to actually have you raise your chin up towards the sky. And remember, it's right next to the C3 dermatome. So right here is the hyoid bone. Just below that is the thyroid cartilage, and below that is the cricoid cartilage. And you can actually feel the cricoid cartilage when the patient swallows. So go ahead and swallow. Good. And you should feel that move underneath your fingers. Next we have the occiput, so I'm actually going to have you lay flat on your back. Put your head here. Yep, other way, flip on your back. Good. So the, go ahead and relax. Remember, the occiput is just, you can relax your neck. The occiput is just at the base of the skull, and remember that is where the trapezius originates from. So that's where I'm palpating on Cole. As I move inferior from the occiput, I'm going to palpate the spinous processes of C1 through C7. Think back to anatomy. Remember, the C7 spinous process is what you can feel when you bring your chin to chest, and it's that one that sticks out straight in the back. So I'm just going straight along his midline, all through the spinous processes. Any pain with those? Nope. Okay. So now that I've gone through straight down the midline, I'm going to go just to the side of that and hit the transverse processes of all of the cervical vertebrae. So I always start my fingers on the spinous processes and then move laterally both to the right and the left, and that will be your transverse processes. These ones are a little bit harder to palpate, so we'll make sure to practice these in class today. Just remember that it's just to the right and the left of the spinous processes. And you'll go all the way down from C1 to C7. For the mastoid process, can I have you go ahead and swing your legs to the side? Good. And I want you to turn your head that way. So remember, the mastoid process is just behind the ear, right in here. So it's posterior to the styloid process of the skull. And then when we are palpating the spinous processes and the transverse processes of the cervical spine, we also want to make sure that we're touching the facet joints. So remember, the facet joints are the joints in between the transverse processes. If there's any tenderness as we're pushing along the cervical spine, facet joints, you want to make sure that you would note that in your SOAP note. And then the last palpation is Erb's point, so I'm going to palpate the patient's clavicle. And I'm just going to move about 2 to 3 centimeters superior to the clavicle, and I'm going to push down, and that is where we would feel the brachial plexus of the patient. If they had any pain or numbness and tingling shooting into their upper extremity, then that would be something you would definitely want to indicate in your SOAP note. Next, we're going to move into the soft tissue palpation. So there are 4 main ones that I want you to know. The first one would be the sternocleidomastoid, or the SCM. So I'm going to have the patient look the opposite direction. And I want you to bring your ear slightly towards your chest. Yep, good. So we can see here, this is the sternocleidomastoid. Just posterior to that is going to be the scalenes. So remember, we have the anterior, middle, and posterior scalenes. We also have the trapezius back here, so you can start back on the occiput and then work your fingers down. Remember, there are the anterior, middle, and the lower trapezius fibers. And then lastly is the carotid pulse, so you can go ahead and just face forward. Remember, that is just going to be just anterior to the sternocleidomastoid.